With all of our digital health services now available at every location, from video visits to e-check-in to our app, you may notice that even your in-person visits are a bit more modern. A new experience for our new normal. We're here to keep your health on track, in person or virtually. And we're moving forward, together.
Hi, everybody out there. How are you? This is Telly Leung, and I hope that this finds you happy and healthy. And I am thrilled to be here for the very, very first episode of Centerstage with Healthcare Heroes, which is a partnership with Playbill.com, as well as Weill Cornell Medicine. And I am thrilled that we are going to bring two phenomenal doctors, one doctor that I've never met before, and one that is very near and dear to my heart, and who I consider to be a vocal savior of mine, who happens to be my ENT and otolaryngologist. The first doctor I would love to bring on is Dr. Anais Rameau. She is a fellowship-trained otolaryngologist and head and neck surgeon with advanced expertise in the evaluation and treatment of swallowing disorders, including acid reflux, something I really want to talk to her a lot about. She also has specialized training in the management of chronic cough and treatment of benign diseases and malignant tumors of the larynx, voice restoration, and airway rehabilitation surgery. And prior to joining the institute, the Sean Parker Voice Institute, Dr. Rameau was an at university and then a fellow at UC Davis Medical Center. Hi, Dr. Rameau. Thanks for being with us today.
Hi, thanks for having us.
I'm so thrilled that I get to meet you virtually this way. We've never met before, but it's wonderful to meet you.
Absolutely.
Our second guest, also from Weill Cornell Medicine and the Sean Parker Center for the Voice, is somebody who I've actually known since 2012 when I was working on Godspell on Broadway. Dr. Lucian Sulica is also from the Sean Parker Institute for the Voice, is the director of the Sean Parker Institute of the Voice of the Weill Cornell Medical College. And his clinical expertise lies in the treatment of voice disorders, including the for the performing voice. He has a special interest in both medical and surgical treatment of vocal cord problems like polyps, cysts, nodules, and scars, and also in neurological voice disorders, including vocal cord or fold paresis and paralysis, and spasmodic dysphonia. Dr. Sulica received his undergraduate degree from Dartmouth College and his MD from Georgetown University School of Medicine, and his research and clinical investigations have focused on the treatment and prevention of vocal cord scarring, vocal cord hemorrhaging, and neurological disorders of the larynx and voice. And he was also my surgeon who took care of me when I had to have vocal surgery in 2017 for a pseudocyst that was on my vocal cords that I had during the run of In Transit on Broadway. How are you all? How are you both doing today?
Great.
Doing great.
Are you coming at us from the clinic? Are you guys in the office right now?
You're in the institute right now, yeah.
It is a place I know very well, and I know that there are many Broadway performers like myself who I feel like we have what I call a team voice, right? And that team voice for me includes a voice teacher who I study with regularly, a speech pathologist or a voice therapist who has sort of helped with the speaking voice. I also have there's also voice and speech teachers that I've had from acting training. And of course, one of the most important elements for my team voice is an otolaryngologist. So Dr. Rameau, for all of our friends out there who are baffled by this giant word, otolaryngology or otolaryngologist, what is it that you do?
Sure. So the actual full term is Autorhinolaryngology, and it basically means the care of the ears, auto, is the nose and the sinuses, and laryngology is for the throat and the larynx or the voice box.
And you'll often hear performers talking about, oh, I have to go see my ENT. So those are sort of the three things that Dr. Rameau has sort of covered in that more specific description. Dr. Sulica, I've been your patient ever since I did Godspell in 2012, which was a very challenging show because we are singing for 2.5 hours straight, a moldy Broadway, which is the Square Theater. And so you always talk about the 5 things that make your voice angry and could potentially cause voice problems. So could you sort of talk about those things and sort of what might come up that might, cause some voice problems for performers like me?
Sure. So these are all factors that can cause vocal fold swelling, right? And for performers and so many other people, the number one factor is voice use. And I don't even mean wrong voice use. There's this term voice use out there that I hate because some people are just called upon to use their voice a lot. And there's no technical issue there, but just the sheer quantity of voice use can make the vocal folds swell. An upper respiratory infection, like regular cold, can make the vocal folds swell. Acid reflux can make the vocal folds swell. Allergies can make the vocal folds swell. And then inhaled irritants, you mentioned mold in the back of the theater, which is sort of traditional in almost every house in town. Inhaled irritants, construction dust, secondhand smoke, these types of things. And they all stack. They all stack to cause vocal fold swelling and increase the potential for injury.
And of course, respiratory problems have, of course, we performers are acutely aware of respiratory problems, but especially since we are living in an age where the entire world is dealing with COVID-19 at the moment, which attacks the respiratory system. What has your experience been like, Dr. Rameau, during this, from March on? What has your experience been like working with patients?
So we went through different phases. Initially, some of us helped cover some of the calls in the hospital, and a lot of our normal clinical activities were stopped. And currently, we have some patients who have had the infection who come to clinic with different complaints, and we're not sure yet if there is a specific trend. For patients who were intubated for a long time, meaning who were on ventilation in the intensive care unit, there is some consistent finding of scarring and vocal fold paralysis or weakness. But currently, we're still studying. Actually, as a team at the institute, we're looking at the outcomes of COVID on our patient population.
And what about you, Dr. Sulica? How has your experience changed as a physician during this time? You're not seeing as many Broadway patients because Broadway has been shut down and closed. But what has it been like for you?
That's just tragic, and it makes me personally very, very sad. Anais described the familiar trajectory. I mean, sometimes we forget how at the end of March and April how little we knew. And there's shortage of the PPE, and we all knew we were going to be sort of called into the hospital, and we had sort of shut down regular care. We're happy to have restored that, some element of normalcy, although we're still taking a lot of extra precautions. Most patients who did not require being put on the ventilator have recovered well in our area of voice swallowing and breathing. The patients who did have to be put on the ventilator, we're just starting to see them come through now with a variety of swallowing problems, voice problems, and breathing problems. It's really too early to characterize, but these patients had breathing tubes for a long time, and there's consequences to that.
Right. One of my, as a frequent patient who sees my ENT often, what I love is that at the Sean Parker Institute for the Voice, that you are constantly still studying this ever-changing sort of bioatmosphere that we are all dealing with. And I love almost every time I've gone in for a scope with you, Dr. Sulica, you've had a student from somewhere else in the world, whether it be Spain or Africa or somewhere, an aspiring ENT, a young medical student who's there to sort of also look at my vocal cords with me. And I think it's important to I think what COVID has done has sort of made us all aware that as much as we know about science and as much as we know about our bodies, there is still so much more we don't know. And that in many ways, I know I turn to the experts when I'm in trouble and I'm in vocal trouble. I turn to you guys. But I think it's also important to understand the human experience that doctors and folks who've gone to medical school for many years and are experts in their field are continuing to learn, because our world is continuing to change. I would love to talk to now, Dr. Rameau. I know one of the things that I struggle with a lot is, when I'm on a show, there are certain foods that I don't eat, because I'm so scared about, oh gosh, these foods are acidic, or this food will cause acid reflux, and it's not necessarily something I feel. And I know so many singers out there, especially young singers, are like, what is this scary acid reflux thing? So can you sort of describe what that is for all my friends out there who have heard this term but aren't very familiar with it?
Sure. So there is a disease entity called gastroesophageal reflux disease, which is basically regurgitation of the stomach contents into the esophagus, which can cause some inflammation in the esophagus. And actually, it is also a cause of cancer of the esophagus. Now, one of the sequelae of gastroesophageal reflux disease can be also laryngopharyngeal reflux, which is reflux that's going all the way to the throat and potentially irritating and causing some swelling of the vocal folds, like Dr. Sulica mentioned. Now, there are lots of myths about reflux, I think, especially among performers. But I want to reassure the audience that a lot of the evidence is poor, and some of the claims are actually unfounded. So in general, having a balanced lifestyle and avoiding things in excess is what is recommended. But for instance, there is currently no evidence that things like excessive coffee, chocolate, or spicy foods are really contributing to the symptoms of reflux. However, whatever makes you feel better and more comfortable when you're performing, please stick with it. There are things that definitely can hurt your vocal cords, and that includes apple cider vinegar, which is something that is sometimes recommended by naturopaths. But actually, the acidity is very injurious to the throat and potentially to the vocal cords. And it can actually activate pepsin, which is one of the enzymes that can cause damage in the throat. So I would recommend to stay away from that.
Dr. Rameau, you're blowing my mind, because I remember being backstage and having a little bit of phlegm, and I had to go on, and they said, hey, Telly, go, just have a little apple cider vinegar mixed in some hot water, and and they're like, it'll cut the phlegm. And I was like, really? I don't know. Is there science behind that? But, you're like, all right, I'll try. When you're desperate and you're phlegmy, you're like, I'll try it. So you're telling me I can drink coffee, that there's no evidence. Now, of course, everybody's stomach and everybody's digestion is different. So I'm not saying go and, I think everybody you sort of have to monitor, listen to your own body, I think is rule number one. But there's no evidence that coffee, like, dries you out. It might make you speedy and a little nutty as a performer. But like pizza, that was like the big thing. They're like, oh no, that's dairy and citrus and all of that. But you're saying that there's actually no evidence that causes reflux, right? So all these things that we've been that many people have told me over the years, you cannot eat this when you're doing 8 shows a week, that it might be okay for me to do that.
So with some qualifications, so obviously you don't want to have a large meal right before you perform, because if your stomach is full, you might be prone to regurgitation. And again, everything has to be done in moderation. So moderate amount of coffee, moderate amount of acidic drinks are okay, but you don't want to do anything excessively.
Right. I remember when I was doing Aladdin on Broadway, my very first number was a lot of jumping around. I was jumping over buildings. I was jumping between carts that were moving. It was sort of a very aerobic, athletic role, and I really couldn't eat very much before the show. I would sort of like snack, by the time I got to intermission, I would have another half a protein bar, because that would get me to the next. But then I would be really hungry after the show, and I would eat after. So for all my performers out there who all they want, you know, I have friends who say after a show, all they want are hot carbs and a cocktail. Like that's all they want after a show. How can that affect, you know, how can that affect you medically, you know?
Sure. So one thing that can cause reflux, though, is having a full stomach before you go to bed. So if your show is ending really late and you're going to have a big meal and also alcohol, that probably will induce reflux at night because gravity will induce the stomach contents to regurgitate in the esophagus. So definitely a lighter dinner in general is recommended, which can be difficult for some of the performers given your schedules.
Yeah. Now, Dr. Sulica, I know, you know, oftentimes if I get a cold, if it's flu season or if I get a cold, I often come and see you and you scope my vocal cords. You put a camera actually down my throat and I'm able to see my vocal folds actually, you know, move and we have to slow down the video to actually see what's happening right on the vocal folds. So, you know, besides just being sick, and I've often seen you and said, oh, Telly, you have a sinus infection, you know, this is how you treat it if it's a bacterial infection, this is how you treat it if it's a viral infection, you know, but how do I know that this is that I might have a problem that's beyond just I'm sick? You know, how does a performer know that they have an issue with their voice that is beyond just, hey, it's a cold, you need to rest, drink fluids, get well? How do they know? What are sort of the signals that performers get?
Yeah. So, you know, it's challenging, right? Because vocal fold swelling, we talked about earlier, is this final common pathway from a lot of different things. But the key is that vocal fold swelling typically goes away with a little bit of voice rest. An upper respiratory infection will run its course in 4 or 5 days. So every performer learns their pattern. And I think what they need to be sensitive to is, first of all, things that are atypical, things that just don't conform to pattern. I mean, if you get a little bit of voice change from using your voice a lot and you're used to bouncing back after 12 hours of voice rest and it doesn't happen, okay, that merits a little bit of attention, okay, if that's your pattern. If problems are recurrent, you know, you mentioned reflux earlier, okay? I mean, if you've been to your ENT 3 times, 4 times for reflux in a year, I got to tell you, it might not be reflux. You know, and one of the frustrations in voice care is how every conversation actually gets back to reflux. But in my experience, reflux is usually not the main issue. So recurrent problems, durable problems that don't respond to the usual interventions, like voice rest, right? Consistent loss of upper register, deterioration of voice with use that didn't used to happen. I mean, if you're doing the same show night after night, you know what the rhythm of voice recovery is, right? If that breaks down, if you're not able to bounce back between shows, these are all things that should get your attention and maybe provoke a look at the vocal folds if it's limiting you.
You know, I know that when I suffered my vocal injury, it was on a show called In Transit, and it was a 90-minute show where I had to sing a cappella, not just on stage, but oftentimes I would be singing off stage. It was a different sound situation because we were all wearing in-ear monitors, something that's usually not done on a Broadway stage. So I might have been, you know, testing that out and maybe overusing my voice because I couldn't hear myself properly. We were also all singing in very different tessituras, which is sort of where the voice sits because, you know, even though I'm sort of a lyric tenor sort of person, if there's a bass that's speaking, I sometimes would have to force myself to sing bass parts. So we were all singing in sometimes I would sing alto parts. So we were all sort of singing in every part of our voices, which is something that is irregular for me. So and for sure, it was something that happened, and the sensation I felt was I know what it feels like to be vocally tired. I know what 8 shows a week feels like. I know what tech feels like of being in a moldy, dry theater for 10 out of 12 hours. But no amount of rest would actually make or drinking water and making sure I was hydrated. I felt like all of a sudden there was a place in my that just didn't line up. So I would go ooh, and I would get air for a minute, ooh. And then it was a very odd sensation. It didn't hurt. So it's not like you injure your knee or you twist your ankle on stage when you're dancing and you feel pain and you feel you know, when you have a vocal injury, it's not necessarily, you don't necessarily feel it, do you, Dr. Sulica? My particular injury, I did not feel
Definitely.
any pain.
No, definitely not. These things don't hurt per se. I mean, sometimes if you really sort of push through, you can get some muscle tension, a little bit of sensation of fatigue in your neck muscles, but they don't hurt. It's exactly the change in capability that you identified. That's it. That's the sum and substance of the vocal fold injury, and you knew it was different from your normal.
Yeah, and the particular injury that I had was something called a pseudocyst, and I'm going to describe it, and Dr. Sulica can correct me if I describe it incorrectly. But the way I always explain it to people is that it's like having a blister on your foot when you wear shoes that don't fit. And you're wearing them all day long, and all of a sudden you get like a liquid-filled blister. And I just happen to have a blister that was right on my vocal fold that was preventing it from actually making a complete closure, so that my vocal folds could, you know, do what it is that they do, which is, you know, they get thinner and they get fatter according to the pitch. And so I wasn't able to make a closure for the air to go through properly, and so there was just a missing place in my voice. I also felt very tired very quickly. You know, I've certainly sung longer than 90 minutes in a show, and I've certainly done 8 shows a week a lot. That was my like 6th Broadway show or something. But at the end of a night, I would feel tanked. I couldn't talk. I could barely talk, you know, or whisper at the end of a show. So how are some of the what are some of the other common sort of vocal injuries that you see, Dr. Sulica?
Well, so you know, many times when somebody sees a lump on the vocal fold, they sort of call everything a nodule or everything a polyp. But for us, you know, we're like Eskimos in snow. You know, we've got 26 different words for the potential lumps and bumps on the vocal folds, and they form differently. They respond to treatment differently. There are, for example, something like a polyp could happen very, very suddenly, and typically polyps will almost always require surgery. A pseudocyst, which is the most common injury we see in Broadway performers, the most common injury, is something that builds up a little bit more slowly. So that's not something that happens on one day to another, but certainly can evolve over the course of a show. The end result is very similar. Often these pseudocysts will respond to voice therapy. In fact, the majority of these don't need surgery. Now, about 1 in 3 patients with pseudocysts ends up in the operating room, not even so much because their voice can't be good, but because their voice can't be consistent over that really heavy vocal demand of 8 shows a week. You know, nodules is yet another thing that can happen on the vocal folds that's a source of terror among vocalists. But I have to tell you, they're pretty common lesions, and they are very, very, very far from the terrible career ender that most people seem to think they are. The vast majority are treated with voice therapy. So you know, there's more. I mean, I could go on and on: cysts, granulomas, what have you. The important thing is to get the correct diagnosis so that you get the correct treatment. Don't, you know, everything is not a polyp, everything is not a nodule, everything is not reflux. And you know, I usually say to performers, the only mistake you can make is not to have it properly assessed.
Well, knowledge is power, I think, and you know, I think it is very eye-opening, and I think I encourage all of my young performers out there to go, and if you have the means to do it, get scoped. See what your vocal cords look like, and not just get scoped when you're sick, because I know Dr. Sulica is always like, I haven't seen you for a while. Oh, you must be sick again. Here you are. But like, you know, after my surgery, I tried to make sure that I would go, okay, every 6 months or so, I really should get, like, even if I feel healthy, a baseline of what it looks like when I'm rested. What does my baseline look like when I'm doing 8 shows a week? And I know Dr. Sulica talks about there's a certain level of swelling and edema that happens just with Broadway performers, totally healthy and normal, but we use our voices a lot. So, you know, another ENT that doesn't work with Broadway performers might look at that and go, you have very swollen cords. And somebody like you, Dr. Sulica, will look at those vocal cords and go, oh, that's normal. That's 8 shows a week. This is Broadway performers. This is what they what they look like.
And Telly, vice versa. You know, I mean, somebody who doesn't work with performers might look at the vocal folds and really dismiss a fairly small irregularity that wouldn't make a difference if it were on my vocal folds as a physician.
Right.
or a businessman's vocal folds or a salesperson's vocal folds, but that will make a huge difference to somebody who's performing. And we'll shrug off something that will have a huge impact on somebody who's using those vocal folds 8 times a week in fairly demanding circumstances.
Yeah, and I know you mentioned speech pathologists and also voice therapists before, and I have to give a shout out to 2 speech therapists that I've worked with through the center, actually, Christine Estes and also Ellen Lettrick, who were phenomenal in sort of repairing my voice. But something that I sort of had to learn, as Broadway performers, there's this, the Ethel Merman school of the show must go on. I'm not calling out unless I'm, on my deathbed sensation. Even if I'm a little sick, I'm going to do the show. And all of that exhaustion is actually cumulative. And I felt like in many ways, it wasn't until I actually suffered an injury and I went to an actual voice therapist that I was able to understand what is tired. Our brains can go, the show must go on and we're going to push through this show, and honestly, that probably was what resulted in my injury, because I wasn't properly listening to my body that needed rest, needed vocal rest. I needed to shut up. I needed some more sleep because we were in tech when I had my injury. So, I have to really, I really have to give a shout out to all the amazing speech pathologists out there, because I feel like they're also doing the kind of preventative care as well. And I feel like many young actors, I went to a training program for theater, but to actually get into voice therapy and speech pathology and also learn how to speak correctly on top of singing correctly, I think is so important.
Telly, I'm so glad you brought that up. Because these are use injuries, right? And we use the sports analogy a lot. And I'm glad to see that it's sort of picked up, because the old paradigm in vocal fold injury is that you're doing something wrong, right? Which really is kind of a blame the patient thing that I really, really dislike, because sometimes you're not doing anything wrong. You're just doing a lot of it. You're in tech. You're a little bit under the weather, but you chose to come in because this is an important week and you're going to push through, right? So these are use injuries. And the same way that an athlete cannot possibly hope to recover from knee surgery without a physical therapist, somebody who uses their voice, not just performers, but other people, that you can't possibly hope to recover from your injury, I don't care how good your surgeon is, without a skilled set of voice therapists. And we're very, very lucky. We have 3 voice therapists at the Institute who just make me look good. I mean, let's just cut to the chase.
And really, that's from the beginning of this talk, I said it is really a team of people. I feel like there is a team of people all working towards your vocal health. That are so important. So as somebody who's gone through surgery, there's also, and I think Sulica, you sort of talked about this, the mental game of going. I know I experienced going. I must be a bad singer, or I must be. It's my fault, or I will never sound the same again, or I will never sing that way. And so. I am sort of living proof, I would like to say, that none of that is true, actually. I actually feel like I sing better now because I went through that experience and I had a better understanding. And I remember talking to Dr. Sulica about this too, and it's sort of amazing full circle moment for me to have my surgeon here who helped me recover. I remember him saying, at some point, you're going to be able to speak about this to people. And I've sort of found it my mission to be somebody who is an advocate for vocal health and for preventative vocal health, to make sure that before the problems arise, before you decide to do the show tired, really ask yourself, is it the healthiest decision for me? Am I doing more long-term damage than what's important right now, which is the show, and what is more important than the show? And that's our health, actually. And I think, if anything, COVID has sort of made that something that we are all aware of as well, that first and foremost, yes, of course, it is very sad that Broadway is shut down, but we also want everybody to stay healthy, and that environment right now is not a healthy place for anybody to be, the audience, the people backstage, the crew, the dressers, the musicians. So health is first and foremost.
Tori, hat tip to you for advocating, right? Because there is such a stigma to having vocal injury. And one thing I always actually ask of my patients, and I think I asked this as the U, I said, you don't have to make a big deal out of it. You don't have to go public. You have, which I think is tremendous. I think it's a tremendous.
That took time, doctor. It took me some time and some,
Absolutely. Absolutely.
introspection to be able to get through that.
You have to sort of get confidence in the post-surgical recovery and understand your own capabilities and all of that. But I've always said, listen, if you ever see somebody else in trouble, just go up to them privately and say, look, it's okay. This usually turns out okay in the end. You've got to take care of this. You certainly can't continue like this. Because the stigma that has developed over the years for vocal injury in a performer is horrible and completely unjustified. The vast majority of these injuries are repairable, many of them without any type of surgical intervention. And for somebody to just sit there and blame themselves, I had, because of my own thing, I do microsurgery all day long. I had a shoulder injury, right? I went to the shoulder specialist at the orthopedic hospital. No one ever suggested for a minute that I was a bad surgeon or I was a shoulder abuser.
Right.
It was all about healing the injury, looking at my ergonomics during surgery, figuring out how I could reposition it so I wouldn't repeat the injury, and that was a lesson for me that I think translates directly to voice injury.
For me, I really did keep it a secret for a long time. And I took your advice, Dr. Sulica, because you said, don't make it a big deal. And I said, I won't. I'm not going to talk about it. And then I realized there was somebody in my company at Aladdin, the show that I did after my surgery. After my surgery, I had my 6 weeks of recovery. I went right into In Transit, and I sang better than I've ever sung before. And then I went right into 2 years of Aladdin, and I sang healthily. But somebody in my company suffered the same exact injury, and me helping that person and telling them my story was actually the thing that helped them get through their injury and their process and their recovery. Now they're singing healthy. They've gone, and again, it took them some time, but they've gone now and shared there with other people. And I want people to walk away from this discussion knowing that this is very common, actually, in our Broadway community. This happens a lot, and that we never criticize that MVP athlete that gets sidelined for the season because they hurt their knee. We just go, we'll see them next season. And there is this strange double standard stigma when it comes to performers of, oh no, that person has had vocal damage. It's permanent. They're never going to sound the same. Are they hireable anymore? Are they going to be a liability if we hire them? Are they a bad singer? Will they injure themselves again on our show? I mean, all of these things, it plays such a mental trick on us. And actually, the majority of people recover, just like I do, and actually recover with a better understanding of our voices.
And it's not rare. I mean, you've got Dr. Rameau and me here. There's a third physician at the Institute, Dr. Sadughi, who wasn't able to join us tonight. We all do this for most of our time, day in and day out. And we're not the only people in town who do this. So that gives you a sense that this is just not a rare event.
Now, I have one question about, and I know that there are many people out there who are wondering if you can talk about steroids. Because I know that there are many myths out there about vocal steroids, the magic pill that when you're sick or when you're ill, you go and you get some prednisone. And I mean, there's even an episode on Smash about it, right? About taking prednisone. So talk to me, and Dr. Rameau, can you just basically talk to me a little bit about prednisone, how it's used, why it's used, side effects, is it dangerous to use?
So prednisone basically reduces inflammation. So if you have, for instance, inflammation of the vocal fold, prednisone may help in reducing the swelling of the vocal folds. It has side effects. The main side effects you may experience in the short term would be basically an elated mood, or some people will have trouble sleeping at night. But in the short term, the side effects are fairly tolerable. The problem with prednisone is that it can mask some other underlying pathology. And if you start relying on prednisone anytime you need to perform because you're having trouble, the problem is that you're not addressing the cause of your of your vocal problem. And that's when you really need to start thinking about coming to see a voice specialist.
Yeah, I have a wonderful voice teacher in New York City who I also have to give a shout out to, Liz Kaplan, who again was a phenomenal teacher before my surgery and helped me build sort of a Broadway technique to get through 8 shows a week, and it was also really instrumental in sort of sewing my voice back together, one half step at a time, and with her teaching, she was all about how can I do the least amount of muscular work to make the most amount of sound? What is the most efficient way for me to make sound in a healthy way 8 times a week? Because vocal fatigue is cumulative. If you're tired on a Wednesday, by Wednesday you're not till Sunday, without calling out. So we all know this as singers. But I also know that there are times when I've had to take prednisone that it doesn't feel like my vocal cords. Sometimes a sound will come out of my mouth and I'll go, that doesn't necessarily feel like it came out of my body, or it feels like it's not my voice, and that's probably because it's what you're talking about, Dr. Rameau, of the masking of sort of what's actually happening and how your vocal cords actually make contact at that moment.
Yes, I completely agree. And sometimes you just need to have some rest rather than pushing through. And especially if you're having a cold, for instance, resorting to steroids can delay your body's ability to heal itself and basically fight the infection. So there are definitely downsides also to the steroids.
For sure. There is one question that has popped through the chat, and I would love to actually address it with the 2 amazing doctors I have here. The question is, I find myself losing my voice at the end of the day on Zoom calls. What can I do to protect my voice? And I think there are so many people who are dealing with this right now, trying to focus all of not just our attention, but our vocal energy into these tiny little boxes all day long. Do you have any advice for my friends who are teleworking on Zoom all day?
Sure. So, for instance, keeping yourself well hydrated is very important. So sometimes when we're at home, we're just not thinking as much about getting up and drinking, and that's very important. So I would keep a bottle of water by your desk. Another tip is actually to use a microphone, because that allows you to basically sound louder without too much effort. One of our speech pathologists, actually Christine, talks about the idea of vocal cache. And basically, you want to be mindful of how much you're using your voice throughout the day, not just how you use it professionally, but also how you use it outside of your working hours, with your family, with your friends, over the phone, for non-professional reasons. So if you're tired at the end of the day, try to pace yourself and limit the amount of speaking you're doing with your family, for instance.
Vocal cache. I love that. And again, a big shout out to our voice therapist. If we do an episode 2 of this, I would love to have some voice therapists and speech pathologists on, because I feel like they do work hand in hand. I know I find this, besides being a performer, I teach. And now that, a lot of performing arts venues are shut down, I find myself teaching a lot more, actually. And I do. At the end of the day, I have a very patient husband, and who, of course, he's been working all day on Zoom calls in one room, I'm in the other room. And at the end of the day, we want to talk to each other. And sometimes I just have to say, I can't talk to you. I just have to go out and take a walk or take a bike ride and not talk to anyone, actually, because I've been talking all day. And it's this idea that it is currency, and we do run out of it. The more we use our vocal folds, the more swollen they get. And it's not necessarily even something we feel all the time. Yeah,
I'd also
absolutely.
encourage the person who asked that question to really, really assess the quality of their voice on a constant basis. And if they find that the effect is getting worse and worse over time, that's something you want to get looked at. You don't want to let that go. The acoustics on Zoom are not particularly good. So Dr. Rameau's advice to use a microphone is a great idea. The other one is use headphones. If you don't use those things, it's very easy to over talk into Zoom. Whenever we think that we have to rely 100% on our voices for communication, and we can't gesticulate or touch somebody or indicate or point or something like that. We always overfunction a little bit.
Yeah. There's another question about that somebody had asked about vocal surgery, actually. And this question is about, what are the different types of surgeries that happen? My particular surgery to remove my pseudocyst, I actually went to the hospital. I went under. Dr. Sulica performed the surgery for a couple of hours, I think it was 4 hours. You wake up and 4 or 5 hours?
No, it wasn't that long. It wasn't quite that long. That might have been.
Maybe it felt longer because I was under anesthesia, but who knows?
That might have been the way you perceived it. Maybe you weren't having fun.
But then the recovery, and they've asked about the recovery process. For me, it was 6 to 7 weeks. Week 1 where I didn't talk, I didn't whisper, I didn't sing. Because the surgery outside of my vocal fold, the goal is to keep these vocal folds apart and recovering as much as possible. So no coughing, no for a full week. And then, the second week, I think I was allowed to use my voice 5 minutes every hour, right, to just say essential things. And eventually with, third week, I was able to go start taking voice lessons little by little, third, fourth, fifth week. But also, there are also some things that are even possible to do now in the office. And that's sort of one of the questions that we had. Performing some surgeries in the office are possible now, and that you don't necessarily have to go under. Can you talk a little bit about those procedures?
So the office surgeries is sort of a revolution in our field. And it's based on some new technology. It's based on actually the rediscovery of some old technology. And certain types of lesions can be addressed using an office laser. I will tell you that as far as performers are concerned, we still tend to favor going to the operating room just because the precision is a little bit better. If somebody is a school teacher or a litigating attorney or something like that, these are people who are heavy voice users, but maybe the integrity of their falsetto isn't really the most important thing to them. So if you get that 98% correct using the office laser and you've saved them a general anesthetic, that's a win. And that's a very achievable thing. For somebody like you, if you came to me today with a pseudocyst, I would still recommend going into the operating room just because I know what type of result you're going to need to continue to function at your top capability.
Right. And even I remember, I remember you telling me, they're like, well, usually even with airways and intubate, with getting air in, that like there's a very special tube that they only use on singers, that you have to make very clear to the folks that are putting you under and all of that, that's very, very, use a very, very narrow tube, and all of that. And so just to protect everything that's in there. But it is a whole different sort of thing. And I've actually told that to my husband. I said, if I'm ever in sort of any emergency situation where I need some sort of tube that goes in my throat, please tell them that I'm a singer and that they need to know that. And so it was a good warning for me as well. Yeah. There's also a question here in the chat about hemorrhaging.
Right.
You hear that term a lot, vocal hemorrhaging. So maybe Dr. Rameau can help me. Just what is a hemorrhage? It looks really scary when you see it on the camera, like when it happens to you. But can you describe what that is?
Sure. So actually, Dr. Sulica has done a beautiful study on vocal fold hemorrhage. So I'll let him speak about it as well. But basically, a vocal fold hemorrhage is when one of the blood vessels, one of the veins in the vocal fold burst and hemorrhages into the lining of the vocal fold and causes swelling and will actually lead to severe voice changes. Now, Dr. Sulica has studied this, and I'm going to let him actually take over now because his study was very telling and was really an eye-opener in our field.
So thank you, Anais. We've touched on a number of times how much catastrophic thinking there is about vocal injury. So hemorrhage is, you're right, it's an ugly looking thing. And even in the medical literature, there are people say horrible things about vocal fold hemorrhage, how it ends careers and causes scarring and that type of thing. And that really, wasn't part of our experience. So one of our briefs at the Parker Institute is actually to put voice care on a more rational, evidence-based type of thing. So we looked at hemorrhages in all kinds of different circumstances. We looked at hemorrhages in the particular study that you're referring to in 41 performers that we had seen over the years. And we looked at long-term outcomes. We followed these people for, I think, an average of 4.5 years after their hemorrhage. And some proportion of them, about 9 of them, had multiple hemorrhages. And we looked for long-term effects. And if that hemorrhage is treated appropriately, which means voice rest until the blood dissipates, there really wasn't any compelling evidence for long-term effects. There really wasn't any compelling evidence for long-term effects. Most of those people were still working as performers, didn't feel impaired, and in fact, felt like they were able to, because of what they had learned of their experience going through the hemorrhage and the medical care thereafter, felt that they were able to self-monitor better than they ever were, which is something that you've alluded to as a result of your own experience.
Right.
So, in rare cases, these hemorrhages become recurrent. They happen over and over and over again. And in those cases, you have to go find the blood vessel that's leaking and operate it. But again, that's the majority of cases. The minority of cases. In most cases, a hemorrhage is a one-off, that it happens exactly as Dr. Rameau said, because one of the tiny blood vessels of the vocal folds decides to leak. Anywhere else in the body, it would be a bruise, big deal, right? On the vocal fold, it's a slightly bigger deal because it doesn't vibrate and it does affect voice quality. But just like a bruise, if you just, tend to it with common sense, a little bit of voice rest, it'll dissipate and it doesn't really leave long-term consequences.
I think describing it as a bruise for my listener for the viewer who asked that question is actually a really wonderful way to make it less frightening and scary, because we all get bruised. You bump into the doorknob and you get a bruise, and it hurts for a little while, and then a couple of days the blood dissipates and you didn't even know you ever got bruised there.
Right, but that visual on that nice white vocal fold to see that smear of red, that's off-putting.
I have definitely seen a hemorrhage, and having experienced one for the viewer who asked that question, it felt like it was like immediate. It felt like that is something, I didn't feel pain, but I definitely was singing somewhere and all of a sudden my cords did not want to stretch to reach that range again. So all of a sudden my voice just fell to a range where I was like, oh, and I lost control. I really did lose sort of like, oh, I'm not really able to sing the way I've been trained to sing all of these years. There's blood on your there's blood in your vocal folds. That's what's happening. And you just have to wait it out. I mean, that was wait until all of the blood.
Yeah, you did not.
I think that's
there's this old notion that you need to go after the blood and drain it. Absolutely not. That's what causes the scarring.
Yeah, and your body does it naturally for 90% of the time. You're 99% of the time. Your body is going to do that on its own. Yeah.
Right.
You both are also both wonderful doctors and are helping people all the time. But I would love to know: is there anything? You guys also do research about the voice, and you continue to do research about the voice in the Sean Parker Institute. Is there anything sort of cutting edge that you are really excited about, that's coming out in your field that you would want to share with us? I've heard some things about, people are starting to make vocal folds out of synthetic materials. That's one thing that I've heard of. That's very exciting for people that might have scarring or nodules, all of that. Is there anything that's in the medical world that you guys are going, this is so exciting? And I know we're all waiting with bated breath for the COVID vaccine, but but on a microcosm in your world, what are you guys excited about?
So it's actually really fascinating nowadays to be in the field of voice, because we're in the era of Alexa and Siri. And certainly one of the things we do at the Institute is do a lot of analysis of vocal samples. And the hope is probably through multi-institutional work that maybe we'll be able to use some of these vocal samples in the future for diagnostic purposes. So that's, maybe a long shot still from now, but certainly something that is in the works. I really am passionate about technology, and I've worked on a few technologies myself. At Cornell, we have the chance of working with Cornell Tech, which is the new tech campus on Roosevelt Island. And some of the work we've done with Roosevelt Island has been around new devices. And one of the devices I work on is for people who actually lost their voice, and that allows to restore voice by using data from the muscle activity of the face and neck.
Wow.
So those are some of the technologies that I'm excited about.
Yeah, Dr. Rameau is the Institute visionary. It doesn't actually say that on her door, but it might as well. I'm sort of the plodding foot soldier, and I get most of my research ideas from the patients. And I've always been struck by absolutely how little we know. And some of the questions you've asked tonight, if a patient asks me a question and I find myself not having the evidence to answer it, there's a study in it. We are right now looking at the consequences of people who sing on steroids. You asked that question earlier today. Why don't we know that? That's not a hard study to do. Well, we're doing it. We're comparing outcomes between surgery in the operating room under the microscope and surgery using the laser in the office. Why hasn't that been done? We're doing it, okay? We regard, our top priority is patient care, no question, but that goes hand in hand with investigation because it allows us to answer patients' questions more clearly and decatastrophize. That's a word I love, decatastrophize, right? And then teach the next generation too, so that they grow up also in this environment of rational approach to these things.
I love that word too, Dr. Sulica, decatastrophize. I think that's one of my favorite things about you being my doctor, actually, is that, I specialize in drama. And so when something when something happens, everything is high stakes in my world. Everything is emotionally attached to things. And I know that when I go to Dr. Sulica, he's going to scope my cords. He's going to tell me exactly what's there. And there's not going to be, the drama and the emotion attached that I have because it's my voice. And that's the thing about the human voice that's so interesting as artists. It's how we make music, it's how we tell each other stories, it's how we communicate. It's singular, and it's there are technologies, as Dr. Rameau said, that will even recognize your voice, because all of our voices are different frequencies and timbres, and there's only one voice, that there's only one person on the entire planet that sounds like us and will ever sound like us. And so it's easy to place a lot of emotion and fear and anxiety when it comes to one's own voice, especially if that voice is tied to your career. And so I thank you. Every time I leave, I feel like it's like Xanax for the voice a little bit. It just calms me. And I leave saying to myself, yeah, knowledge is power. Seeing what is on my vocal folds, seeing the swelling, having a doctor like Dr. Sulica, explain to me exactly what's happening to me. It actually helps me go, okay, this is not going to end my career. I'm going to sing fine after I get well from this cold or this sinus infection or whatever that is. I'm going to recover from this hemorrhage, even though it looks like there's blood on my vocal cords and it looks insane, but I'm going to be okay. It's knowing all of that. And I thank you too, the both of you, for being here today and dispelling the myths that you have and giving us the knowledge that you have, and sharing it with singers, who are just starting out on a certain level, and also singers like me who've been doing this for many years but continue to learn. I have one last question for you all. And it's actually a personal question, and I don't really know this. What made you decide to go into this? What made you decide to specialize in this? Was there a moment? And I'll start with Dr. Rameau. What was that moment for you that made you go, this is what I want to dedicate my life to?
Well, my grandfather was a poet, and he was also a smoker, and he used to basically read his poetry in public. And one day his voice became hoarse, and he was found to have a cancer on his vocal cord. And at the time, the technology was different, and he underwent the surgery. He looked the same, but as soon as he started using his voice, he was a completely different person. So that's why I really dedicated my professional life to this.
Amazing. And what about you, Dr. Sulica?
So a little bit more prosaic. I was one of these people who went to medical school a little bit reluctantly, with some parental pressure and that type of thing. And, I got through it, but I never really found, it was intellectually interesting, but I never really found much passion until I actually found ENT. And that was super interesting because you work with all kinds of things that really speak to our identity and with which we interact with the world, with our hearing, facial expression, voice, all of that. And at the end of my training, my then chairman, who was a real old school cancer surgeon, took me aside and he said, well, what do you want to do? And I said, well, I don't know. I sort of like everything. And he was from the deep South and he was from a certain generation that wasn't necessarily mine. And he looked at me and he said, well, I'll tell you what. You speak all these foreign languages and you go to the theater and you read books. You're going to go into laryngology. Now, you have to understand that in old school surgical training, these things are a little suspect. All of these things. So he says, you're going to go into laryngology. And the moment it came out of his mouth, I'm like, yes, of course I'm going to go into laryngology. And you're absolutely right, even though your premises are totally wrong.
Well, I'm glad. He might have been wrong, but I'm really glad he pushed you in that direction because I know
he really was. He inspired me a lot.
And I know you have definitely saved my voice for sure. And there are many of my performers out there who consider you such an important part of their vocal team. I want to take a minute and thank you. And Dr. Rameau, it is wonderful to meet you. And thank you so much for everything that you've shared today. I know hopefully this knowledge will help other singers who might have some fear and anxiety about having vocal problems or vocal issues. And I encourage you to go seek out the experts. There are phenomenal doctors at the Sean Parker Institute for the Voice that will give you the knowledge. And like I said, knowledge is power. This is the first in a long series that we're going to be doing with Weill Cornell Medical. I think the next episode is featuring my dear friend Nikki James. There's also going to be an episode featuring my friend Jessica Vosk. And if you want to find out more about this intersection between medicine and the theater, you can visit playbill.com/healthcare heroes. But once again, I want to thank our two guests today. Thank you so much for being here, Dr. Rameau and Dr. Sulica. Thank you. We appreciate you.
My privilege, my pleasure.
Same
Take
here.
care.